Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Raudatul Ilmi and I will present about personal protective equipment. Personal protective equipment is equipment that must be used to protect worker from hazard that can cause serious injury or illness related to their work. Personal protective equipment has been specifically designed according to the type of work. For example, PPE for construction workers will not be the same as PPE for laboratory workers. A personal protective equipment or PPE is clothing or equipment designed to reduce employee exposure to chemical, biological, and physical hazard when on a work site. It is used to protect employees when engineering and administrative control are not feasible to reduce the risk to acceptable levels. The three basic types, however, even the strictest control will not necessarily eliminate all the risks associated with most job tasks, and this is where the need for PPE must be evaluated. A hazard assessment can help identify which specialized PPE will be required. There are numerous types of workplace safety equipment available depending on the hazard exposure and work condition. The following are basic PPE that can help protect employees. Function of PPE use differing in PPE level. In their use included number 1, at level 1 PPE they are head covering, surgical mask, glove, and medical clothing. This PPE is used when health workers are in strike before examination, and this used when health workers are general public. Number 2, PPE level 2 consists of head coverings, goggles, and 95 masks, gloves, and aprons. At this level, the PPE is used during the COVID-19 fever clinic, medical personnel in the isolation room, used during immediate examination of suspected patient, and when cleaning medical instruments that have been used by suspected patient. And at level 3 PPE, there are goggles and 95 masks, handshake, and all jumps with cover, used when health worker incubated, tracheotomy, bronchoscopy, gastrointestinal endoscopy, and suspected or confirmed patient, used during operative procedure or autopsies in suspected or confirmation patient. The difference in PPE level 1, 2, and 3 have different rules. Different for each other use, the following are 3 levels of rules for the use of personal protective equipment based on their location and coverage. Number 1, PPE rule. For the first level of PPE used in less risk location or condition. The type of PPE that fall into this category or various type of mask, work gloves, and disposable rubber and hazmat. Number 2, PPE second level. This level of personal protective equipment used by doctor, nurse, laboratory personnel, radiographer, pharmacist, and COVID-19 patient room cleaner. PPE at this level is used by medical personnel, doctor and nurse, in the polyclinic room when examining patients with symptoms of respiratory infection. Number 3, third level PPE. At the third level of PPE, it is injected for production room and operating produced in patients with suspected or confirmed COVID-19. For doctor and nurse, they are required to use N95 mask or equivalent special mask, both eye protected or face shield, disposable sterile rubber, surgical gown, head covering, and apron. Conclusion: personal protective equipment or PPE is a set of tools used by workers to protect all or part of his body against the possibility of potential work hazard or accident. PPE is used as a last resort in an effort to protect workers if the business engineering and administrative cannot be done properly. The type of personal protective equipment are head, face, and protective equipment A, ear, breathing, hand, feet, and body. The impact on workers if they do not use personal protective equipment is that they can increase the fatal risk if a work accident occurs. Maybe that's all for me. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.